My name is Cesar Lopez, and I'm going to be performing hand washing with soap and water before going into my patient's room. I will first turn my faucet on to a medium warm flow, rinsing from my wrist down, letting the water drip to my fingertips. We want to make sure the water is not too hot because it can remove some of the oils that protects our skin. We want to apply an appropriate amount of soap and rub in a circular motion. Cleaning your palms, your hands. You can also clean using the bottom, your fingertips. We want to clean the back of your hands. Your wrist. You want to make sure your hands stay below your elbows while doing this process. In between your fingers. Your thumbs and the webs of your thumbs. Clean your fingers, fingernails, and underneath your fingernails, especially if you have long fingernails. You then want to rinse the water from your wrist down to your fingertips, from cleanest to dirtiest, making sure your hands are not too close together. You want to avoid shaking your hand as well once you're done. Grab some paper towels and pat dry. Same, from your wrist down to your fingertips. You then dispose of this properly. Grab a clean paper towel and turn off your water. Now that my hands are washed, I will be gowning up with my personal protective equipment to go into my patient's room. You want to start off by grabbing your gown. When you open your gown, you want to make sure that it does not touch the floor or anything around it because it can be contaminated. Make sure you tie your gown up. You will then proceed to putting on your mask. You want to make sure the mask goes underneath your chin, over your nose, or the bridge of your nose, and adjust the bridge to fit your face. I will then grab my gloves. And I will put the gloves over the gown. Make sure there's no exposed skin. You want to make sure the cuff of the glove is over your gown. Okay. I will then go to my patient's room and introduce myself. Hey, how's it going, sir? My name is Cesar. I am your student nurse for today. I will begin a set of vitals. Can you please verify your name and date of birth? Okay. And you can also inform them that the reason you're wearing your PPE is because he's under contact precautions for whatever reason, and it is for his safety and your safety as well. Once you're done doing what you had to do, you could then go to take off your gown. First, you want to start off with your gloves by pinching the outside of your glove, making sure your dirty glove does not touch your skin, and you can ball it up. You then want to use whichever finger you want and grab underneath the glove and dispose of it properly. You will then proceed to untie your gown. You want to slide this off your shoulders and touch inside your gown. You want to make sure that you don't touch the outside of the gown because it is considered contaminated. Once you put it off your shoulders, you want to pull away from your body. Touch the part that was touching your skin and ball it up in a slow, decent flow. You do not want to ball this up too fast because it can flop around and contaminate your skin or your scrubs. Dispose of this properly. Taking off your mask, grab both the loops and then you want to make sure you pull away from your face without touching the outside of the mask, and dispose of this properly. Now, once you take off your PPE, you can then proceed to washing your hands with soap and water. For the purpose of this video, I will be jumping into my hand sanitizing. So to sanitize your hands, you just want to put an appropriate amount of hand sanitizer. Rub your hands in a circular motion, the back of your hands and your wrist. You want to make sure you rub until it is completely dry. If you were to put on gloves after this procedure, you want to make sure it is dry because you don't want to have gloves on. Moisture, it's not good. Make sure you don't flop your hands around or wave them around because there could be particles or microorganisms in the air. And you're good to go. Thank you.